So this is a presentation on pertussis and the importance of being vaccinated by Brian Overeem. So we're going to start off by just saying, okay, what is pertussis? Pertussis is commonly known as whooping cough, and it is present in children who have not been vaccinated or people who are immunocompromised, so they're more susceptible to developing a secondary illness such as pertussis. So the relationship between measles and pertussis goes back historically. When we see a rise in measles epidemics, we've also seen a rise in, shortly follow after, we would see a rise in the pertussis cases and the development of an epidemic there. Due to the immunosuppression effects of the measles virus, it allows secondary infections such as pertussis to basically come back in to the body and get the person sick, because their body is been so depleted from fighting off the measles infection that it's now really susceptible to being infected with another illness. It's the same reason why if you're a surgical patient, you are more likely to develop an illness such as pneumonia. There's also a time lag that we've seen between the two epidemics. It takes about 3 to 4 weeks. And this is well within the measles immunosuppression range, which is 4 to 16 weeks. So now, the big topic of the anti-vax movement. So, over the past few years, we've seen parents not wanting to vaccinate their children, and this is seen by the case surges of measles in the United States, Japan, Ukraine, France, all the well in the medical field with the vaccines to take care of it, but they just don't want to do it. And because of the historical link, we can also suspect to see the pertussis cases rise as well within 3 to 4 weeks in some people after. And because when pertussis now comes into an immunocompromised body, it becomes fatal to that individual. They tend to focus on outdated and inaccurate research, such as vaccines cause autism in children. This is completely false. There's no link to this whatsoever, because autism is a genetic disorder and not one that can be brought on by a vaccine side effect. And this is a major standing point to everyone who believes in that they should not be vaccinated or not vaccinate their children. And with our society being so in and focused on social media, it makes it really easy for these people to get their message across, because they can block out people that try to tell them what's actually true, and everything they say is not filtered or fact-checked at all. So they just keep preaching all this wrong information, and it's getting out to everyone, and because it's not fact-checked and people tend to follow things that may sound true, it ends up being completely false. And the big thing that also helps this is celebrities and influencers that we look up to. They have this huge following that if they were to say something, we automatically think that, hey, this must be true. So if they're using fear or the continuation of preaching that vaccines cause autism, then you are going to get those people that completely agree with them and not do it, and we're going to see these cases rise and children not be vaccinated, and this could be very fatal to that child. So now, the big thing to help combat this is the role of healthcare providers. In Great Britain, they did a large clinical study to see the importance of educating the population. They were focusing on topics on like immunocompromised people. If you were to go visit them, make sure all your vaccines are up to date so you don't give them a secondary infection. It helps protect the vulnerable population. So people who would be considered vulnerable people are the elderly, women who are pregnant, and young children. They would also another focus is on educating parents and teachers about getting vaccines and staying up to date with their vaccines, because we have a lot of teachers that work with young children, and these children don't have the best hand hygiene or hand washing that we would expect of a high school student or an older student, such as someone in grade 6, 7, or 8. And when they cough or sneeze, they tend to do it into their hands and not into their elbow. And this is just the best way for disease to spread. And if you have someone in that class who can't be vaccinated for some other reason, such as they're immunocompromised or their immune system does not allow them to get vaccinated, it could be really fatal. It could be fatal to that child. The best way that we protect society is a way called herd immunity. So we have to vaccinate at least 60% of society to keep this herd immunity up. And when we educate parents about that, it's like, hey, you're not just protecting your kid, but you're protecting this person, this person, and this person. It would really drive that nail home to some people, because it's like, it's not just focusing on them, it's trying to protect everyone. And teachers of the young, as I've already said, of those younger, so the preschool, kindergarten, grade 1, grade 2, we really need to protect these kids because they're not the best at doing hand washing. And if they're not doing that, we need another way to defend themselves. Defend them, and in this case, getting them vaccinated helps protect them. The vaccines also protect the elderly. Grandparents, great-grandparents. If we weren't in a lockdown because of COVID-19, we would like to spend a lot of time with these people, and they help teach grandkids and lessons that their parents can't teach. And if your kid's not vaccinated, you can get them sick, because in the elderly, there's always another underlying condition. We just don't know what it is sometimes. And with pregnant women, they're especially vulnerable to illnesses. It won't be as bad for the woman or for the mother to be, but it would be extremely difficult for that child. And it might not just be difficult, but it would be most likely fatal and cause birth defects for that child. So in conclusion, the best way for us to protect society and protect everyone is to make sure that we are getting vaccinated for measles and pertussis. Mostly pertussis because it's a secondary viral infection, which will cause fatal consequences.